Bony anatomy of the foot and ankle include the fibula, the tibia, the lateral malleolus, the medial malleolus, the calcaneus, the talus, the cuboid, the navicular, the three cuneiforms, the five metatarsals, the phalanges, and the hallux. The ligamentous anatomy of the ankle includes three main ligaments: the posterior talofibular ligament, the anterior talofibular ligament, and the calcaneofibular ligament. The muscular anatomy of the ankle and lower leg includes the soleus, the gastrocnemius, the tibialis anterior, the peroneus longus, the peroneus brevis, the extensor digitorum longus, the extensor hallucis longus, the plantaris, and the Achilles tendon.
Now starting off with the bony anatomy of the knee, we have the femur, fibula, and tibia, as well as the kneecap, also known as the patella. Ligamentous anatomy of the knee consists of the ACL, PCL, LCL, and MCL, as well as the lateral meniscus and medial meniscus. Muscular anatomy of the knee. Starting off with the quads, we have the rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. Now hamstrings, we have biceps femoris, semimembranosus, semitendinosus. Calves, we have the gastrocnemius. Back to the quads, we have tensor fasciolata. Behind the knee, we have the plantaris and the popliteus.
Now we're going to cover bony anatomy of the hip joint. The hip is the articulation between the femoral head and the pelvic bone. The pelvic bone itself consists of the ilium, ischium, and pubic bones. This articulation is the femur in the acetabular fossa and is aided by the articular cartilage and synovial fluid and surrounding synovial sheath. The ligamentous anatomy of the hip consists of the ischiofemoral ligament, the iliofemoral ligament, also known as your Y ligament, your pubofemoral ligament, and your round ligament, which is on the interior aspect of the hip and attaches inside the acetabular fossa. On the anterior aspect of the hip joint, we have the rectus femoris, and on the posterior aspect, we have the hamstrings, which consists of the semitendinosus, semimembranosus, and the biceps femoris. On the deep posterior aspect, we have the deep six, which consists of the piriformis, quadratus femoris, superior and inferior gemellus, external and internal obturator. On the lateral aspect, we have the tensofasciolatae, and then there are three gluteus muscles: gluteus maximus, gluteus medius, and gluteus minimus. There's also an adductor group of muscles, which consists of the pectineus, adductor brevis, adductor longus, adductor magnus, which isn't listed, and gracilis. On the anterior aspect, also known as your Taylor's muscle, is your sartorius, and then the major hip flexor is the iliopsoas complex, which consists of psoas major and minor, and the iliacus. During the cocking phase of the kick, elastic energy is stored as potential energy within the quadriceps muscles. This stretch, which is placed on the quadriceps muscles, happens through concentric contraction of the hamstrings and glute max, which put the hip in extension. At this time, concentric contraction of the deep six also causes external rotation, along with glute med and glute max. As well as those two motions, concentric contraction of the glute medius and gluteus minimus cause abduction at the hip. At the end of the cocking phase and beginning of the acceleration and swing phase, elastic energy which was stored in the quadriceps muscles, specifically rectus femoris, is transferred into kinetic energy. This happens through the concentric contraction of the rectus femoris and iliopsoas complex, which causes power production as well as the concentric contraction. Along with this, the concentric contraction of the adductor muscles also helps to produce force and provide adduction. At the point of ball contact, the rectus femoris transitions from a concentric contraction, which is force producing, to an eccentric contraction to ensure the hip does not return to extension. The ball contact phase is followed by the follow-through. In the follow-through phase, the hamstrings act eccentrically to slow the flexion of the hip. At the same time, the glute med and min contract eccentrically to slow adduction of the hip. The final stage of the follow-through is the landing mechanism. When the foot strikes the ground, the glute med is put on an eccentric contraction to prevent the hip from popping out, similar to the Trendelenburg gait.
At the knee, the first stage of kicking after the approach is the cocking phase. This is done through the concentric contraction of the hamstring, which causes flexion at the knee. The cocking phase is when we create potential elastic energy, which is stored in the muscle fibers of the rectus femoris. The next stage of the kick is the acceleration leg swing phase. During this phase, the rectus femoris contracts concentrically to convert the potential energy to kinetic energy and produce force. At the point of ball contact, the rectus femoris transitions from a concentric contraction to an eccentric stretch to provide power and prevent knee flexion. The final phase is the follow-through, during which time the hamstrings contract eccentrically along with the plantaris and gastrocsoleus complex to slow the extension of the lower leg and to prevent injury. The last phase of follow-through is the slowing of the drop of the body on ground contact. This is done through the eccentric contraction of the quadriceps muscles to slow the drop of the body as well as the bending of the leg at the knee joint.
The muscle actions of the ankle are: during the foot plant stage, the dominant striking foot begins its motion into plantar flexion. This is done through the concentric contraction of the gastrocsoleus complex, as well as the plantaris in both flexor digitorum and flexor hallucis longus. This plantar flexion of the ankle continues through the cocking phase to ball contact. At the point of ball contact, the tibialis posterior and extensor muscles are put to a quick eccentric contraction in order to prevent more plantar flexion and to provide a solid striking surface for the shot. The ankle joint remains in the plantar flex position through the follow-through until the point in which the foot strikes the ground. At the time of contact, the gastrocsoleus complex, plantaris, and flexor muscles contract eccentrically to slow the drop of the foot